So I always ask myself at these meetings, who will be in the audience? So just to start off, could I just get a raise your hand if you've heard of Akadeum or our flotation-based technology or microbubbles? Okay, leave your hand up if you've used them. Okay, so our goal to start off is to return here in a few years and have most of you raising your hands. And what's driving that and what our vision is of the company is to develop the next generation of separation and activation technologies and products to minimize harm. So harm to the cell, where you get the best and most potent cell at the end of the process, making it as easy as possible for the user, simplifying the workflow and eliminating complexity, and ultimately resulting in a better outcome for the patient. If you're asking how we do that, well, we use, which I alluded to earlier, microscopic floating particles. We call them microbubbles. And what you can do, and the video is going to play here and I'll narrate on the next loop, the microbubbles, first what they're made of, they have a solid shell and a gas core. So you can put different molecules, antibodies on the surface and target a cell that you want to isolate. So you see in the video the blue spheres there, those are the microbubbles. And upon mixing, they can latch on, and will latch on, say, to T cells in this example. Once they're attached, you can float them to the top, and everything else sinks. So what we're doing and what we've deployed, and we have a couple products available already to do this, is applied that technology and the platform to a protocol in a Leukopak bag. We can scale this into other formats, but to kind of walk you through here, if you have your cells you want to isolate, you'll add an antibody cocktail. That then attaches, in the case of a T cell, it would be CD3. You add the microbubbles, they attach to the cells through the antibodies. And then after that, just through gravity alone even, you can actually initiate that flotation process of the microbubbles going up, everything else going down. And what you then do is just by draining the bag, you now have your T cells attached to the microbubble. You can then activate. And so through culture, the cells will naturally fall off of the microbubbles. And what that does, and I'll show some data on this later, is it minimizes the damage or the wearing out of the cells. So these cells become very exhausted, and we have way lower exhaustion levels by using this technique of releasing a cell and keeping the activating particles away from the cells. Ultimately, you can go down into your downstream processes and ultimately complete the workflow. So just to kind of show you what this looks like, this is a time lapse. What you see on the top, you'll see a white layer starting to form. That's, here, I'll start the video. So that what you see there is several hundred million microbubbles accumulating to the top, and all the other cells are falling down. And again, you can carry out your process and isolate like I showed in the previous slide. Okay, so what does that do for you? What does it actually do for the user? Well, what I should ask is what was missing from the video? What was missing was anything to initiate the separation. So there was no magnet, which you can squeeze the cells under high magnetic forces. There was no acoustics to try to initiate a separation, and no transducers. And there was also no microfluidics. This can work because of the background of gravity, which initiates the separation. What that means is you can seamlessly integrate into practically any size or shape container. So this is scalable unlike any other separation technology that's out there. In addition to that, we have best-in-class performance and can also scale out. And ultimately, what we really like too is that it's a very gentle separation technology. Again, leaving those cells in as pristine condition as possible. I'm going to risk showing a slide, probably that's been shown many times here, which is just the general workflow of CAR T. If you're looking at allogeneic, we kind of summarize the 6 steps here. And what we wanted to start show, if you look at that was the technology, okay, what products do we have and what have we deployed? So the first is in the step of isolation of the T cells. We have negative and positive ways of isolating cells. After that, we have another product that can also activate the T cells. And so that was the one I referenced earlier where the T cells are floated to the top. And when you culture, they'll naturally fall off activated, and you're keeping those activating particles away from the cells to minimize exhaustion. And if you're doing an allogeneic workflow, we also have products that can deplete or just simply remove an unwanted cell. So that, imagine an unwanted cell at the end of your process that you simply want to remove before you finalize formulation. Those three products, the first one here is a negative selection product. So this is essentially removing everything except the cell that you want to use. What's really nice, immunologists typically, the feedback is they love that because you're leaving the T cell untouched until you actually want to do something with it. So we have this available now at the leukopak scale. We'll have a GMP grade version of this coming very soon, by the end of the year. We also have a T cell activation and expansion product where isolation occurs with that kit as well. And that also is a research grade available now and clinical grade. The plan is to essentially perform biocompatibility testing, leachables and extractables, and have that completed in H1 of next year. And the last product category is depletion, where you're just, again, removing the unwanted cell, that unengineered cell, or in the case of this product shown here, removing dead cells. So very simply, you can attach these microbubbles. They'll gently float out whatever they're attached to, and quickly and efficiently, and you can remove, if you want to, an unwanted cell in your formulation. And I should say that last product, the dead cell removal, was actually based on customer request. They approached us and saw what the technology could do and said, if this is something you could develop, we'd love to be a customer. And that's ultimately what led to that product that I showed there. Getting a little bit more specific, and I'm not going to go into each one of these steps, but this is, again, an example of a workflow for autologous T cell therapy. And you can see there, again, those two kits, the isolation through negative selection, activation, expansion, where they fit in. And allogeneic, again, at the end of the process, when you're scaling up, you can remove those dead cells or unengineered cells that you want to remove from the process. Okay, so that's a little bit about the products and the technology. I'll show a little bit of data here, but I do like to start because, I know you've seen a lot of data at this conference. I've seen a lot of data in my career. I always like to start with, what's the goal? What's the point? And if you look even at why we developed those three product categories you saw before, they were based on user problems or user needs. So we use human-centered design, we spend time with the target users, and we listen to what are problems they're facing. So the first one is just issues and challenges with any scalability up in volume for technologies that are separation or activation, or out in terms of number of samples. And again, that goes back to what you're actually using external to the bag or to the tube to initiate separation. The second one is efficacy. So again, if your T cells are exhausted or worn out, how many of them, when they go into the body, are actually doing the job you want them to do? So that's something we've heard a lot about, is just wanting to minimize manipulation of the cell and keeping it as pristine condition as possible, minimizing any levels of exhaustion. The last one is time and cost. So, if there's poor recovery, in some cases you can't even get enough T cells to carry out the process, the goal is to get enough recovery and yield and do so of healthy cells to minimize the time and cost of any process. So those were the three problems we were focused on with the products, the three product categories I showed before. And I have the data for this on the next slide. But you can see here, we rose to that challenge and developed a suite of products that very elegantly solve these problems and address them. And that's something we continue to do with our product suite and portfolio that we have coming out over the next couple of years. Okay, now let's look at data. So we have users performing some of this work, and we also do in-house studies and investigations, of course. Enhanced scalability in testing, and one of the things I'll show in a minute here, we do have a closed system that we're starting a beta program on. And what we've seen is we can have 4 times higher throughput in terms of cell number and also in terms of sample numbers. If you go back to what I was saying before about gentleness and exhaustion, this is a comparison of T cells across a multi-day fold expansion. And in this case, we looked at an exhaustion marker. So, on the y-axis, high is bad in this case, low is good. And you can see over time, by leaving, say, magnetic particles that might sit with the T cells and then exhaust them, by using microbubbles, which keep, again, the activating particles away from the activated cells, you minimize exhaustion levels by quite a bit. So this is something we're very excited about, and what we just released in part of our activation expansion product. The last one, time and costs. So in this case, I'll have to just tell the story of yield. We've actually seen, for at least our dead cell removal, that's we're about a 2 times higher yield than other methods like magnetics. And if you think about that, if you're wanting to, or if you're needing to have a technology like that to remove dead cells and allogeneic workflow, I mean, doubling the yield is a very big deal. I mean, if you just think about trying to extract the valuable cells away from the ones that are less valuable, and doing so with as many as possible to maximize the impact of those cells. So those are the 3 products we have now, the categories, and we have more coming in this, in each one of those categories that we'd be happy to talk to you about if you're interested. And an important step we're taking now, and I'll show these 2 together, is then packaging those consumables, or those reagents, I should say, into our BioRise plastic consumable and into the Alarion instrument. So what this does is it takes that promise and the value proposition of our products and brings it into a closed system that's also semi-automated. So very little hands-on work that you have to do here. And again, this maximizes the workflow we saw before and brings the promise of those value propositions I said before into a closed system. And we do have that here on site. So if you're interested in potentially being a beta, please come see us. And that's something we'd be happy to show you. And it is here at the conference today. Okay, quality is another thing that I just feel like I have to talk about because I know probably a lot of you have seen different reagents and consumables. And the question is always, well, what is the grade? So we're already a CGMP compliant organization. We have those facilities in Ann Arbor, Michigan, and we're manufacturing our first 2 GMP grade products later this year. And that's something we like to use, not only internal quality team, but also external. We really work, we believe, with the best because we take that serious, and that's where we feel like we're going, being integrated into those clinical workflows, and that's what we've positioned and gotten ready for. Okay, so I just want to summarize. Oftentimes, people get excited about this. They ask what's available, what are we doing? So I just thought I'd end with ways to work with us. The first one is tech demo. So like that video you saw, we do have a table and a booth here. So if you want to see the bubbles in person, either come see me or go to the table. Andrew is at the table. If you could raise your hand, Andrew. Yep, so come see Andrew there. And we also have the Alarion instrument, like I mentioned. And another thing I didn't mention is that we partner. So because of a powerful platform like ours, we have Akadeum branded products where we're very focused with the specific portfolio. We have partners also who will integrate our technology into their products. If you are a developer and you have, say, some custom ligand or antibody, that's something else we do is customization. And for either of those, Jill, I don't know if Jill's in the room. Jill's way in the back there, so please see Jill. And the last is we are kicking off our Series C financing. So that's something that we've initiated. And if you would like to discuss that or you're an investor, please come see me. I'll be out in the back here for a few minutes. With that, I'd like to close, and thanks so much for your time.